The role of vision could be mainly pre-planning the reaching and grasping components. So assessing the environmental conditions, environmental context, such as regulatory conditions, and prepares the estimates of those two components. So our vision, well, we have binocular and monocular vision and central peripheral vision. So let's have a look at the effect of lacking binocular vision. So with monocular vision, the grip size usually increases and force actually decreases when we just use one eye. So the Jackson, Newport, and Shaw study, they actually had the pressure sensor attached to the object. So had the subject to close one eyes and did this prehensile movement, and they actually increased the max grip aperture but decreased the force of grip, which indicates that increased the grip size probably will due to the increase in safety margin, because they're not as accurate as using the binocular vision, and reducing the force might be related to underestimation of the object size by monocular vision. Well, how about central and peripheral vision and prehensile movement? Well, the Brown, Halpert, and Goodale just used the peripheral vision, effective peripheral vision, on the prehensile motion. This was their study. So the object was attached at the center, but actually they were looking at certain spots. So they were using peripheral vision to grasp the object. They had two tasks. One was estimating the object size by moving their thumbs and index finger to estimate the object size by just looking at this spot. So that was kind of perceptual task. And the second one was actually when they rested the hand there and just reach for that object at the center while looking at that fixation point. In order to investigate different eccentricity of the fixation point, they sometimes look at this point or that point and that point. So these gray points indicate the different fixation points. And the results show that the perceptual estimation, which was to judge the size by estimating the size by their thumb and index finger, their perception was the same for all different fixation points. So whether they look at this, and that, this object size estimation was the same, because part of the reason is they knew that the object wouldn't change in the center. So their perception stayed the same, but when they reach out for the object, so real action was involved. When the real action was involved, the max aperture of the finger increased with further fixation point. So the grip increased with further fixation point. In other words, if they look at this point and reach out for the target, compared to this point and reach out for the target, well, this point had max aperture size greater than looking at this point. So this study indicates there is actually separation for vision for perception and vision for action, because vision for perception indicated, which was represented by estimating the aperture, stay the same, while the vision for action, the grip, affected the grip, max grip aperture size. In regards to both central and peripheral vision, if we look back into the lecture, task intrinsic lecture on vision, there was actually a study done by Sivak and McKenzie in 1996. So what they did, if you can remember, what they did was they either had a contact lens which blocks the central vision, or they either had this goggle which blocks the peripheral vision. And looking at the prehensile motion, and what they found out was, if they block the peripheral vision only, only the transport component was affected. But if they block the central vision, both transport and grasping components were affected. And this indicates that directing the point of gaze at the object is crucial, because point of gaze indicates the central vision, and it's also known as foveal vision, and it's critical to both transport and grasp phase.